Good evening, everyone. I'm Stan Sklarov, Dean of Arts and Sciences, and I'm here to welcome you to the annual Gitner Family Lecture at the College of Arts and Sciences. I'm thrilled to see so many people joining us here to hear from my colleague, Professor Donna Pincus, both here on the Charles River campus and from around the globe in the virtual setting. This is a very special year for the Gitner Lecture, as we are celebrating the 150th anniversary of the College of Arts and Sciences, founded in 1873 as the College of Liberal Arts. And it is also an exciting time for us as an institution as we move forward with many of the initiatives of the 2030 Arts and Sciences Strategic Plan, for which Donna played an important role as chair of our Natural Sciences Task Force. The task force thought about the future of the natural sciences at Boston University, how we build on areas of excellence, hone our collaboration and interdisciplinarity in our teaching and research, and enhance our impact on pressing challenges in the world. Tonight's annual Gitner Family Lecture marks one of my favorite opportunities to promote the tremendous research and accomplishments of our faculty. The annual Gitner Family Lecture was established to highlight current BU faculty members whose teaching and research addresses topics of major importance, of broad interest and benefit to the BU community. Tonight's lecture certainly fits that bill. Before we introduce Donna, I want to thank Jerry Gitner and his family who are joining us tonight via Zoom for making all of this possible. A dedicated alumnus, Jerry Gitner, CAS class of 66, graduated with a BA in history and was elected to Phi Alpha Theta, the National History Honor Society. He is a trustee emeritus of Boston University and a current member of the CAS Dean's Advisory Board and the Pardee Dean's Advisory Board. Jerry is a principal of Cross-Continental Capital LLC, an investment company he co-founded. He serves as chairman of Global Aero Holdings Limited and DG Associates, Inc. He is a past member and chairman of the Financial Advisory Board of the town of Highland Beach, Florida. Among other roles, he has served as CEO and chairman of the board of Trans World Airlines, vice chairman of Pan American World Airways, CEO of Pan Am World Services, and president and co-founder of People Express Airlines. This past summer, when one of our interns interviewed Jerry as part of our preparations for our 150th anniversary, he responded, quote, "I'm living proof that there is life after the College of Arts and Sciences in the business world. Coming to my career from a degree in history rather than business or engineering, I had a very different perspective. Fine arts, music, languages. I was analytical. I knew how to think and question. One of my mantras is, it's not the answer, it's the question that is critical. In the College of Arts and Sciences, we have learned how to ask the right questions." Unquote. Tonight, we gather to ask important questions about stress and anxiety and to hear answers and strategies for managing anxiety. To begin, I'd like to welcome Dr. David Summers, who will introduce our speaker and moderator. Dr. Summers is the chair of the Psychological and Brain Sciences Department. His research employs functional MRI, psychophysics, and computational modeling to investigate the mechanisms underlying visual perception and cognition. As the director of the Neuroimaging, Perception, and Attention Laboratory, he and his team perform experiments to identify the human brain circuitry which supports different visual tasks and study the different cognitive factors such as attention, how attention modulates these circuits. Please join me in welcoming Dr. Summers.
Thank you, Stan. I'm thrilled to introduce Dr. Donna Pincus, CAS Feld Family Professor of Teaching Excellence at Boston University. Donna has been the director of the Child and Adolescent Fear and Anxiety Treatment Program at the Center for Anxiety and Related Disorders at Boston University since 1999. Her research is focused on the development of new treatments for children and adolescents with anxiety disorders and their families, with a particular focus on understudied and highly impaired populations of youth. She has also investigated the role parents and families play in the development, maintenance, and prevention of childhood disorders. She's been the recipient of numerous research grants from the National Institute of Mental Health, as well as from local foundations. Dr. Pincus's current research focuses on ways to develop and refine treatments for child and adolescent anxiety disorders, as well as on novel ways to integrate treatments for child anxiety into community settings, such as schools and pediatric primary care. She's currently collaborating with public school districts to test the feasibility and efficacy of interactive web-based treatments for panic disorder and other anxiety disorders in middle and high schools. She's also co-leading a pragmatic clinical trial funded by the Patient-Centered Outcomes Research Institute, PCORI, to evaluate the relative effectiveness of therapist-led versus online formats for treating child and adolescent anxiety in pediatric healthcare settings in 4 regions in the US. Dr. Pincus graduated summa cum laude and Phi Beta Kappa from Brandeis University in 1991 with a BA in psychology. She completed her PhD in clinical psychology at Binghamton University, specializing in the assessment and treatment of children's fears and anxieties and children's coping with stressful events. She completed a clinical internship at the University of Florida Health Sciences Center and joined the faculty at Boston University in 1999. Dr. Pincus has also dedicated part of her career to sharing accurate information about effective cognitive behavioral treatments for anxiety disorders to the public. She has appeared on both local and national media networks, including NBC's Today Show, Nick News, National Geographic Television, Women's Lifetime Television, ABC News 2020 Downtown, and Good Morning America. She's recently published a book for parents and caregivers, Growing Up Brave: Expert Strategies for Helping Your Child Overcome Fear, Stress, and Anxiety. Dr. Pincus regularly gives talks and workshops on child anxiety to parents, teachers, students, and healthcare professionals around the nation. Donna's research program is one that touches me personally. One of my daughters struggled with selective mutism from preschool through 3rd grade. For those years, she spoke to only 5 people in the entire world. I believe there are other parents listening today who are facing the fears and challenges of raising a child with an anxiety disorder. I'm deeply grateful for Dr. Pincus's leadership in developing effective clinical treatments for our children. Before I ask us to welcome Dr. Pincus, I would like to make another introduction. One of the great components of Dr. Pincus's work is that she very actively engages undergraduate and graduate students in her research laboratory activities, as well as serving as a mentor to students developing their own research projects. Tonight, I'm pleased to introduce Christine Lee, a 3rd-year doctoral student in the clinical psychology program at Boston University, working under the mentorship of Dr. Pincus. Christine is interested in research in investigating how to achieve equitable implementation of evidence-based interventions at the intersection of schools and mental health care to better serve youth of color. She's dedicated to a clinical and research career focused on addressing systemic and scientific inequities that contribute to gaps in access, engagement, and quality of mental health services. She will moderate the Q&A session after Donna's presentation. Now, without further delay, please join me in welcoming Dr. Donna Pincus.
Just want to thank everyone, first of all, for the warm welcomes. And I want to thank everyone for coming out on this very cold and very rainy November night. And just to have everyone in the room and to welcome everyone who is here with us virtually. We kind of feel your presence and really hope that you enjoy tonight's performance and tonight's lecture. So tonight, I'd hopefully like to get you involved because I feel like every time I ever learned something that really mattered and really I used the material, I got engaged in using it right in the room. So hopefully everyone has got like a little straw that I handed out in the very beginning. We're going to do a couple of activities tonight. But I'd like to talk and first of all, acknowledge the many people who came together to make tonight happen. So from development and alumni relations to this the entire College of Arts and Sciences, the staff, to David Summers, to Stan Skleroff, to Margaret Bolter, so many people. Christine, thank you for coming. And to my undergraduates who came from my developmental psychopathology class, I'm really excited to see you here. And I also want to recognize my colleagues. A number of colleagues came out tonight, and I know a number are with us virtually from the psychological and brain sciences. And I also want to acknowledge my collaborating partners, because this research that we do is not done in silos or alone. It's done together. So I have colleagues who I'd like to acknowledge, and I will as we continue to talk about the work that we've accomplished here at BU, and how exciting it is to have work that we're doing that actually makes such a difference in people's lives. And I explain this because when I first came to BU, what was very exciting to me was to work at an internationally known center for anxiety, a place that has an overarching mission to make a difference in people's lives. And we do this in 4 different ways. One is through clinical research. Another way is, so it's advancing what we know works in helping kids to thrive and helping adults to thrive and feel happier. We also do this through clinical training and research training with graduate students and undergraduate students, and we include them in all of the work that we're doing. And we also provide treatment to the public. So whether you're a young child suffering from selective mutism, or a teenager suffering from panic, or an adult who is looking for methods to stop worrying so much and actually feel like you can get better sleep at night. We actually are right in the front lines in providing evidence-based care. And what that means is that it's not just something you heard worked, but something that through a lot of our research is actually, we know, has an impact and can make a positive difference. And in that sense too, we're not isolated. So we know that the city of Boston, our local community, as well as the larger community more broadly, we're involved in community outreach. And so many of our community partners now are stakeholders in our current research. So this partnership really benefits everyone. So this is why it feels special to be at BU. It feels special to be at the Center for Anxiety. And I also mentioned being in Boston gives us a great opportunity to use the city of Boston for exposure. So you might say, what's that? Well, for doing things like being afraid of sitting in the middle of an auditorium. We've got auditoriums, we've got elevators, we've got Boston, we've got crowds when the Red Sox come, we've got the train, all these kinds of places that people might say, I can't go there because I get too scared. Well, we actually, you might think of therapy as being something where 2 people sit in a room and just chat. Well, you might not have imagined therapy to be something like where you're going up rickety elevators in the middle of Boston, or where you're helping someone with the fear of pigeons in the middle of Comm Ave by breaking up little crackers and letting all the pigeons come and gradually helping someone feel a little bit better. So you might not imagine that the city of Boston and our surroundings are so integral to the kinds of treatments that we do. But again, BU and the wider, broader community, we bridge the 2 together. So what has brought you all either tuning in or in the room tonight? It's because this topic is important. And there's probably not a single person in this room or online who has not felt what it feels like to feel anxious, or to feel when anxiety starts to get in the way. So sometimes we know that anxiety is a normal human emotion, but anxiety can actually get in the way, and it can affect everyone from young children through older adults. And we know that they can interfere in functioning. So when you are not able to do things because your heart is racing fast and you're so focused on your own thoughts, and that negative self-talk is in your mind saying, I can't talk here, I can't, go into the school dance because somebody is going to maybe laugh at me or ridicule me. All those self-talk that can be negative can really make you decide you're turning around and you're not going. And many people don't get the kinds of help that they need to be able to just enjoy being where they are. And our job is to make sure that those treatments are available. So to start, can anybody think of a way that anxiety, if you have too much anxiety, can interfere in someone's life? Can anybody think of one way? What domains of life? Thank you, Caitlin, for being our first person to have Brave Talking. You get some relaxation CDs. So now I know all the rest of you are going to be raising your hands as well. So right, any other ways that anxiety can interfere in someone's life? You think, yes. Schoolwork, right? So if you are anxious about school, or if you're so anxious, you might not be able to concentrate. So for those of us who are faculty or hoping our students are paying attention, if you make the situation in the classroom so anxiety provoking, someone might not want to speak up. So here, this is for you as a thank you for being our first 2 brave talkers, and there's plenty more parting gifts for everyone at the end as well. So yes, we know that whether it's the way you work, the way you play, the way you socialize, anxiety can really get in the way of all these different domains in life. So if we think about even teenagers who are supposed to be trying to be a little more independent, if you have panic and can't leave, can't go to the mall with friends, it's very unlikely that, again, you're going to be feeling very independent. In fact, I remember several patients who said, nope, I'd rather just stay at home. Or if I go to the mall, I only have to go with a parent, or I really can't be with my friends. And although that sounds great to the parent, it might feel like, wow, I'm the only parent ever that has my child who wants to go to the mall with me. In fact, we know developmentally, it's super important for kids to be able to spend time with each other and spend time with friends. So it can impact our relationships. It impacts the way that we feel. So you can have distressing physical symptoms that get in the way of you being able to do your work or to play. And hopefully, anxiety is a natural emotion that you never have to feel as a distressing. But if you don't treat it when it starts to become distressing, it actually can start to merge into other kinds of problems. Can anybody think of one other kind of problem where if you stop doing the very things that were important to do, if you stop doing them because of anxiety, what kinds of other issues do you think might come up? You're staying at home all the time. Yeah. Yes, thank you. Depression, you might feel sad, you might start to feel withdrawn. And here you can see how one problem could then start to link into another problem. But one hopeful message is that sometimes by treating the anxiety and starting to get people to do things again, that depression or sad feelings can go away. Without necessarily even having to target it. So sometimes treating one problem can actually have a very positive impact on other problems. So why is now the right time for us to talk about anxiety? Well, we know that rates of anxiety problems are increasing globally, both for kids and for adults. And we know that these rates just started to increase, not just at the time of the pandemic, but actually even prior to the pandemic. And then the pandemic further exacerbated or caused additional problems as people were isolated. And there were other contextual issues. If you put this all in the mix, you can see where then suddenly the world opened up again and everyone's expected to sort of perform and do their jobs and go to school. And they hadn't been used to doing those things. And there's many different factors that affected people in very many different ways. And there's very real, not just unrealistic stressors, but realistic stressors that many of us faced. And they were different for everyone. And they actually could cause people to have problems with mental health issues. And there's lack of access to quality care. If you called up any number of places, if you were looking for help for a loved one, you may not get help the minute you call. Someone might say, well, there's a 6-month wait. I might be able to see you next June. So sometimes that's not helpful. When your child is suffering or your friend or your loved one is suffering, you want them to get help right away. So I come to you tonight, though, without the doom and gloom message. What I come to you tonight with is actually a hopeful message. And that message is that over the past several decades at BU, I have seen, and in our field broadly, I have seen there's a number of clinical trials that have been done from child through adult, some that are done right here at our Center for Anxiety and at BU more broadly. And we have learned that there are many effective treatments. And that has really grown over the past several decades. So now that we have these great treatments, our job is to make sure that these treatments are available to the people who need them the most. And many of our trials show that high rates of kids don't have any problems anymore. They actually, 75 to 80% of youth in some of our trials are actually diagnosis-free when they're done. And so many of them didn't need medications for this. So that's a hopeful message. And we can change developmental paths or trajectories. It's not too late. So I have actually, although I specialize in anxiety, I've been trained in treating anxiety across the lifespan. And for years at BU, I treated adults as well as children. And it's helped me to really appreciate how malleable we are and how it's not really too late to be able to learn a new kind of coping skill or to adapt a new behavior. And I do believe, though, to do this, we need to work together, so not in our silos. And we talked about a lot of this in our strategic plan about the future and of the natural sciences. And I believe this is the same here in this field of anxiety. By working together with our community partners, we can think outside the box. We might be able to think more in a more novel way. As I teach undergraduates, I've had so many undergraduates say to me, well, there's textbooks already written on psychology. What more could I have to add? Well, perhaps you're from a cultural group that really could use a mental health treatment, but we need to adapt that treatment so it's more acceptable to that group. And you may be the very person to help us with that. Maybe you're someone who has techniques and experience in working with moving treatments online or web-based treatments, or how to harness technology for good. We need your help. I've had students in marketing, in business, and all these other areas that might look at what we're doing with a fresh perspective. And by connecting together, I believe we can really do our part in trying to improve people's overall well-being. So as I launch into this, I will tell you what we're going to do tonight. So in this next hour, I will dive a little bit into the nature of anxiety. I'll tell you how you know when you need help. So you want to know when it's interfering. Throughout, I'm going to tell you some of the stories of some of the trials that we've done here at BU. And I will also tell you some of the evidence-based techniques that you can take home with you today. Some that are action that you can actually do when you get home, put into action for yourselves. And there's probably not any of us that couldn't become a little more brave in some area of your life. Maybe there's something that you have avoided doing. And if you had just done it, it would have opened up your world. And I will share with you a sampling of some of the research that's been done that is already doing this, that's helping young little preschoolers to learn about stress and anxiety, or learn better ways to identify emotions, or research that's going on where we're looking at various formats of treatment and understanding better for which kids might benefit most from a treatment that's in person, and which families might benefit most from a treatment that is online, or which children. So to begin, let's start with the nature of anxiety. We've all probably felt like this baby at some point. We know that anxiety is a natural emotion. We've all felt what it feels like when you're about to take that exam. Your heart was racing a little bit fast, but you do it. And actually being a little anxious might have helped you study a little bit more. We've also felt maybe what it felt like to perform. That little bit of heart racing right before you perform actually helps you. We know it's sort of part of that fight or flight system. But we might have also can relate to when anxiety gets too high. And for this little mouse, Wemberly, this is a popular children's book by Kevin Henkes, and Wemberly worried about everything. She worried about big things, little things, and things in between. And she worried in the morning, and she worried at night, and she worried throughout the day. When you worry too much, said her mother. When you worry, I worry, said her father. Too much worry. Worry, 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 said her grandmother. Too much worry. And if you notice, grandma has a Go with the Flow t-shirt on, is wearing rollerblades and has a cane. So she is not feeling very anxious. She's ready to go. But what was striking to me is that a first grade teacher used this book and actually highlighted what are first grade worries. Well, that struck me, and I took a picture of it because I thought, wow, that first graders are even able to say that they had something on their mind. We sort of take for granted that childhood of what do they have to worry about? Like probably they're out just playing or thinking about other things, but every one of these kids could say what Wemberly worried about and what was on their mind. And I want you to think to yourself what kinds of things you think young kids, teenagers, adults, older adults worry about. And that if you think about it, some of those worries change across development. Maybe you're a young child afraid of going to school, afraid of separating for the first time. Maybe you're afraid of social situations, or as an adult have worry that continues about finances or about loved ones or about your health. We know that we are all constantly kind of surrounded by potentially places where we could feel anxious. So kids are surrounded by these images of fear. And I would say that, in fact, we tend to accept that we're happy sometimes and we're sad sometimes. But what happens as soon as we're anxious? People usually say, just relax, just calm down. We don't really accept that emotion of anxiety. We tend to shoo it away and say that you shouldn't feel that. But in fact, kids actually are quite fascinated with it. They sometimes seek out watching cartoons, other kinds of shows where there's images of people or characters feeling afraid. And some who come to my office say, Dr. Pincus, can I see your pop-up book of phobias? Some of the kids just love that. And they tell me, I love Halloween. I love watching scary movies. I even love the feeling of going on a roller coaster. I love the feeling of skydiving or like doing something really dangerous. And again, some ways that's a feeling that some people actually enjoy. So it's not something that's always avoided. And in fact, we're also surrounded by images of bravery. If you ask any child, they may be able to tell you who they identify as someone who they think is brave. And these images are surrounding us. And we know that anxiety is a natural human emotion. And in fact, it's adaptive, it's protective. If you ever tried to walk out in the middle of Kenmore Square and you did not wait for the walk sign, I'm not saying I've done that before, but occasionally you might have that occur, and all of a sudden you lurch back. So again, we know that our body has that natural system that protects us in case of danger. Usually it is okay, it improves our performance, but the emotion usually goes away on its own. And many kids who come in say, well, my anxiety is a little different. Mine doesn't go away on its own. In fact, I get sweaty. I have stomach aches and I feel nauseous. Like I really feel like I'm going to throw up. I'm dizzy. I have shortness of breath. All those things come on and they feel like this is not going to go away. And that's what sometimes keeps them from doing things. So I would argue if you were like, think about a deer grazing in the field and suddenly you're being chased, probably wouldn't be adaptive to suddenly decide you're going to stop and eat some grass or just kind of graze for a little bit longer. Of course, it's going to be more important that you run. So immediately the body sends like a lot of the blood to the legs. You start to run, you try to get away, and you might feel your heart racing fast. So I think for just to take a moment to bring these feelings in, and I want you to see how actually your body already knows how to bring the feelings down. So just take a moment. Hopefully everyone has their cocktail straws. You don't need them quite yet. But what I'd like you to do is just to turn your head from side to side. I'm going to do a series of just 3 exercises. And as you do this, I want you to focus on what kind of symptoms you're bringing on by doing that. Now, I mean physical symptoms. And I will just do it for a few minutes if you can. Again, it's somewhat rapidly if you can, just to bring on the feelings. Okay, stop. Can anybody shout out a physical symptom you're experiencing? Dizziness. Anybody else? Blurry vision. Okay, I'm sorry. No, so all those feelings are very natural that come up. Stop for a second though, and just notice and raise your hand when you feel those symptoms have gone away. Okay, so I want us to note that it only took about 10 seconds for those symptoms to go away. The next activity I'd have you do is to just rise, and we're going to just run in place. So again, if you need to make any adaptations for the exercise, do that. But then you can check the box that you've done your exercising for the day and you've gone to a lecture. So we're just going to jog in place. And I want you to try to bring on your heart rate purposefully. And again, as best as you can, to try to bring on your heart rate. You're doing a great job. Thanks. I see those in the back. Great job. All right, and stop. Can you shout out a symptom that you're feeling, a physical symptom? Anybody? Heart racing, heart racing. Shortness of breath. Anybody else? And a little sweaty. And giddiness. All right, we had some like positive emotion in there as well. Okay, sit down for a moment and then I'll have you tell me, raise your hand when you feel that symptom has gone, those symptoms have gone away. Just notice it, notice in your body. And I've already see a hand up. Let's just keep note of that. Interestingly, we had nausea, we had shortness of breath, we had sweatiness, and it feels like I see most hands up in the audience that the symptoms have already kind of dissipated. Probably in about 10, 15 seconds, they've gone away. And our last one, you all had cocktail straws for those who were in the room tonight, and for those who were online. If you have a cocktail straw, you can use it, or you can kind of do some breathing out if you want. But we're going to have you breathe through the cocktail straw without breathing through your nose. So just have the only air that you're getting for just the next little bit is just through the cocktail straw. Okay. That one's the hardest, but I want you to try to bring on those feelings. Okay, and stop. I'll have you do it just for a little bit. Tell me the symptoms that you're feeling. What was that? Okay, and what else? So you're air hungry. Yes. Lightheaded. A little bit of tension. Okay. So now I want us to notice when those symptoms come down. Just raise your hand when you feel like you're kind of back to where you were when you first walked in the room. Okay. Most hands I see, a sea of hands up. So I want us to notice that it only took, again, a few seconds, even for the hardest of activities. Truth be told, you just did a part of a treatment that we use for panic disorder. And this is a treatment, it's a fancier term than it needs to be, but it's called interoceptive exposure. And it's learning not to let what we feel scare us. And what we do is we do a series of exercises to purposefully bring on symptoms, to have us not relaxing. You'd imagine that that would be the primary thing we do out of a center for anxiety, is to teach people to relax, but it's exactly the opposite. Let's bring on these symptoms and try to understand them better and watch what the body already knows how to do, which is bring down those symptoms within a very short period of time. And then I want you to imagine, though, that you're an adult, you're maybe a teenager, and you've gotten into math class, and suddenly you feel short of breath, you feel nauseous, you feel dizzy, you feel sweaty. What would probably be the first thing that would happen? You don't know, because you didn't do all these activities. You didn't just breathe through a straw or jog in place, but you get to math class and you feel that way. What would be the first thing you think that you'd want to do? Run away. Exactly. Avoid. And the more you avoid, then it's harder to get into math class the next day. Maybe you don't even go to school at all that next day because math was so hard, and just even the thought of going, and what if it happens in another classroom? And then maybe you're avoiding sitting in the backseat of the car when your friends want to go on a trip. You're avoiding lots of things. And in fact, the more you avoid, the more your world starts to get closed down more and more. But when patients come into the room, we might do things like bring on feelings, teach them that these are actually quite natural human emotions, and that these emotions go away. And one of the things that kids love to say is that, well, how could it be adaptive to actually be sweaty? Anybody think about how it's adaptive to be sweaty? Why is that actually like just hardwired that that's what happens when we get anxious? Yeah. It keeps you cool. That's one part. What else happens when you're sweaty? Yes. Okay, stress relieving. Any other ideas? What if something was going to grab you and you were covered in sweat? You're slippery, exactly. So the combination, you're slippery. And when you tell kids this, that, oh, that's why I get sweaty. It's because I'm kind of almost like a superhero. I've kind of covered myself in sweat, and now I can't get grabbed if I needed to be. And they start realizing that, oh, my body already knows the only reason why I'm dizzy is because my body thinks there's something dangerous here. So it's getting all the blood to my legs. And like all these things, you start making sense of all of these different symptoms, and suddenly they don't seem so scary. You break them down into these different parts and understand better, why is your heart racing fast? So the trick is, though, sometimes that, you're not really in a place where you're in danger, where you're a deer grazing the field and suddenly a tiger is about to chase you. You're not in that situation, hopefully, in math class. But again, your body sometimes reacts as if you are. So just starting to understand that is actually one of the very first sessions we do, truth be told, whether you came in for any kind of anxiety problem to our center, would be a psychoeducation. And we teach kids that anxiety is almost like a watchdog, but it's one of those little yappy dogs that like barks a lot of times, and it barks even when there's nothing scary there and nothing really for you to worry about. So we have to kind of retrain that dog and retrain the dog to only bark when there's really a danger there. And sometimes that can be a tricky thing, but we do this all the time with kids. And externalizing it, making it into something that you can kind of say, talk to, kind of like almost like a watchdog, can actually be helpful. So we know that fear and anxiety is very normal and it's natural, but sometimes it can start to interfere. We also know that we seem, even cross-culturally, there seems to be a developmental progression of fear through life. So starting even in childhood, it's adaptive to feel afraid of something that's a large object. You've never seen that before. What if it's not safe? It's very adaptive for you to start to be afraid of separation from a caregiver. So I don't want to pathologize this very natural human emotion. If we all feel it as human beings, no matter where we're from, we all feel this, and we see this progression developmentally. As we become more cognitively able to think about things that aren't there, things that are more abstract, we start to think about things like the dark or monsters. Older kids start to think of things that are more abstract, like their own self, their own well-being, climate change, all kinds of things that we hear from teens, that they start to become more passionate about these kinds of issues. Why do fears arise? We can't only blame our parents, although that would be an easy thing. We know there's a genetic component for sure, but we don't actually inherit a specific anxiety disorder, but actually might inherit a vulnerability to anxiety. And that we may feel more prepared at specific ages to feel anxious. And as well, we have those environmental factors. Maybe you're watching mom scream when she sees a spider. If you're a parent, you might have to modify your reactions, knowing that you have a little one watching you as you respond, because again, fears can be modeled and we can acquire them in different ways. And maybe you were born with a more inhibited temperament. Those kinds of things can be vulnerability factors for anxiety. As I started reading the literature and started to see all this research coming out about what parents should do, what parents shouldn't do, or caregivers, I also gave lots of talks in the community. And I had one parent who said, can't you write this into a book? Help me to know, what should I do? What shouldn't I do? And also to know, what is the research telling us? And so some of that inspired writing Growing Up Brave. It was this one parent who stood up in the middle of a group and said, my teenage granddaughter, grandparent said, my teenage granddaughter is not leaving her room. And had I known all the things that you're teaching me right now, I might have been able to change something along the way. So she really wanted user-friendly strategies. And she said, write it down in a way that anybody could understand it. And that's what actually inspired me to think about writing some of the things that wind up being in journals, but some of the findings that are in journals don't get into people's hands in everyday life. So I think that is an important thing, is translating that to make sure they're available. And we know that overprotection can be difficult because it doesn't give kids opportunities to try new things. Modeling anxious behavior can be difficult and actually causes more anxiety. And being too controlling, not giving enough autonomy. So here's an example. I don't worry about anything. My mom does all the worrying for me. So it might be great for them because, she's pretty worry-free. Or this cartoon, which is the classic overprotection, like maybe that child should have to drop the ball sometimes in order to know what that feels like, to cope with that negative emotion, and that mom doesn't have to swoop in all the time. And that being said, though, we can't blame parents, because as a parent myself, I know that feeling of wanting to protect, and it feels very real when you feel your child is hurting. And so again, knowing how to navigate, how do you balance that protection and also giving kids appropriate levels of freedom and opportunities to make mistakes sometimes. So how would you notice, we're at the part 2 of our talk, how would you notice anxiety? If you saw someone anxious, how would you know when it was interfering? And I think this was an important message to make sure we all know this. So number 1, you can see it physically sometimes, especially if someone tells you. Although you all couldn't tell if I was having a panic attack right now, unless I actually behaved in a way that told you that I was having a panic attack right now. But some things that people do feel is restless. They may have difficulty sleeping, hard time keying down. Maybe kids report and adults stomach aches. Oftentimes you get a stomach ache right before the exam, or you're not feeling well, you have a headache, and as soon as the exam's over, everybody in class tells me you feel hungry. Everybody, you feel relaxed again. So again, these are some of the things, though, if it's happening frequently and it's interfering and you can't shut it down, it may be time to just look at some options. And in fact, some of the treatments don't have to be, years of therapy. Interestingly, we can help patients get better, sometimes in a matter of a few hours with the right types of treatments. The kinds of behaviors you might see is refusing to participate in things that you did before. We had a research collaboration with school nurses right prior to the pandemic in the Framingham Public Schools. And what we noticed there was that so many of the nurses said, kids are coming to our office and we can give them an ice pack or we can let them lay down. But a lot of them are coming because of anxiety. They're not becoming because they're really sick, or they think they might be sick because the symptoms feel so real, and they are real that you're feeling them. Just the cause may be anxiety. So noticing overutilization of school nurses' offices, noticing tantrums. If you're a young child, anxiety can come out as a tantrum. So you can't just label a behavior of a tantrum as being oppositional. Sometimes the function of that tantrum is something a little bit different. We also can see anxiety problems facing us throughout the lifespan, but we know there's a progression. And I teach this in our developmental psychopathology class. How do different disorders emerge at different times and for what reasons? And what are the risk and protective factors that might actually help us change a child's trajectory? There are certain anxiety problems and that we see, and I roughly put them in order of when we see them developmentally. Separation anxiety is one of the first. We see kids who have a difficulty separating from a caregiver. Selective mutism, as Dr. Summers mentioned, the difficulty with speaking to someone else, usually someone not in the family or to other people. Specific phobias. You can actually have a phobia or an exaggerated fear to anything, whether it is pigeons, as I had mentioned before, or a fear of costumed characters. Believe it or not, our mascot, like the terrier, actually has come and helped us with some great exposures with kids who were about to go to Disney World and then couldn't go because they had such great fears of costume characters. And we gradually can expose kids to facing some of those fears. But you can feel you can have fears that come up to many different kinds of phobias. We have generalized anxiety, which is worries, social anxiety disorder, which is really feeling scared of being in social situations, as well as panic. And panic really is the fear of the physical sensations. You're not afraid of the mall. You're not afraid of the place that you are. You're actually afraid of what's going on inside your body, and afraid that maybe it means that you're going crazy, or maybe it means I'll have a heart attack. And that meaning can actually make the symptoms even worse. So the labels, I have to say, don't matter so much. I wanted you to know what they were, because there are different ways that we might understand how they kind of fall in terms of the kinds of symptoms people experience. But truth be told, the treatments that we might do, with some minor tweaks here and there, we have some treatments that work exceptionally well, that are skills-based, that work regardless of what kind of specific label you have. So I will tell you now in part 3, some of the evidence-based treatment strategies that help. And I'll also tell you about some of the research we've done that have contributed to the body of literature that has created some of these treatment strategies. So first, overall, we know that usually our frontline treatments should be those skills-based treatments, and we call them cognitive behavioral treatments. We also know that medications can be helpful as well for kids and for adults, maybe when they need a little bit of traction in bringing down some of the physiological feelings so that they can actually learn some of the skills. And sometimes a combination of the medication and treatment and skills-based treatment can be helpful, but we usually try skills first prior to medication. And overall, our goals are to help people feel better. You're not only reducing the negative things like the symptoms, the heart racing fast, the number of panic attacks, the number of separation anxiety incidents, but you're also trying to look at other areas of the child's life or the adult's life, build on someone's strengths, and help someone learn new ways of coping with stressful situations. So with young children, and I've organized this developmentally, how would that look? It's creating for at the youngest ages, waiting till you're older, and not only focusing on that, actually disregards a whole developmental period where we could be trying to teach kids to understand emotions, creating consistent, predictable environments for kids, even in preschool settings, teaching simple feeling helpers, we call them, kind of like emotion management techniques. And I will acknowledge Christine Lee is involved with me with a collaboration with the Boston Public Schools currently, with also my colleague, Dr. Jennifer Green from the Wheelock School of Education. And this is funded by the Wheelock Institute for Early Childhood Wellbeing. And we're partnering with several different people in the Boston Public Schools, and they're helping us, they're stakeholders, but we're doing this collaboratively. And our aims of our project are to develop a preventive intervention for educators. So the educators themselves in the Boston Public Schools are needing tools for managing child stress as well as for their own stress and anxiety. And how can we make those two go together? And it's an interdisciplinary project, and it's exciting to have undergraduates, graduate students, faculty are all part of this collaboration. And so many people have great skills, including like the ability to create all these great online training programs. So here's just a sample of a teacher feeling helpers handout that we give to teachers, but we're creating an entire online training for teachers. And that is scalable. So we might start at the Boston Public Schools, but there's probably so many other schools where there's teachers. And I know this because we gave talks during the pandemic to teachers at Head Start. They were needing some additional support. And so how can we do this? The other thing that you might not know about this CD that I handed out, that it's, even though I said you don't want to only teach relaxation, relaxation can actually be helpful for when you are wanting to fall asleep at night, for kids wanting to know the difference between your body being tense and your body being relaxed. And I created this relaxation CD, although now the new wave technology, it is more like you can download it online. There's lots of other ways to get it, but I thought I'd bring some treats for you tonight. And some of the kids that came to the center created the art for it, and the BU Orchestra played the intro to the CD, and someone donated all of the sound effects for the CD as well. And so there's like sound effects that you might hear from cartoons that you might find are familiar, and that was all donated to create this. And I'm leading kids through progressive muscle relaxation, so learning the difference between our body being tense and relaxed. And truth be told, many adults have said, I actually like listening to the CD myself, because again, it kind of helps us. Anyone can kind of benefit from something like that. When I first came to BU, I noticed that there were very few treatments for young children. Most of the treatments for anxiety were for kids 7 and older. And we launched the very first clinical trial at BU, developing a treatment for early childhood separation anxiety disorder. And this is a picture of what is called parent-child interaction therapy. You're actually coaching a parent from behind a one-way mirror. They have a little microphone in their ear. You're teaching them skills. You're watching them use the skills. You're praising them while they use the skills. The more they use the skills, the more they use the skills. The more you praise them, the more they're using the skills with the child. It becomes a very happy experience to do this kind of work. And so we ran this clinical trial to actually adapt a standard type of parent-child interaction therapy for kids with separation anxiety disorder. And the part that our team developed was recognizing that we really needed for parents of anxious kids to develop Bravery directed interaction training. How do you take a child who experiences separation anxiety and will not leave the parent's side, even clinging to the parent's leg, and gradually have them doing things like going to ballet class, going to do activities, going to a birthday party. And we did this in a gradual way. We taught parents skills, and actually in 9 weeks, I will show you, the kids got much better. So here's the number of separation incidents, pre and post treatment, and even at follow-up, you see a drastic change in how many times they're tantruming or having big separation incidents is the way we had operationalized it. We also saw changes in the severity of separation anxiety. And so the kids who received the modified PCIT, which is our treatment, did so much better than those who were on the wait list. And these changes seem to be maintained over time. So even when we followed them up to 12 months post-treatment, we saw the changes and improvements in their change and in their anxiety feelings. And 73% of the kids no longer met criteria for separation anxiety disorder, which is very exciting. So that was like one of the initial trials that we had done. And now we are building on that to understand how can we take that and actually modify it so it's briefer and it's more transportable or more scalable to other kinds of settings. So how would you help people, not just preschoolers, but as you get a little bit older? Well, you already learned one of those techniques. And one of the techniques was anxiety psychoeducation. So again, learning that anxiety is a human emotion, learning that it's age appropriate, learning that there's that you have ways that you can teach somebody a fight or flight system and what it means. You can draw an outline of the body and teach someone about the sympathetic and parasympathetic nervous system, but you do it in a way that's very easy. So you're not using big words, you're taking away the jargon, and you're teaching somebody how to break down emotions. So when we think about anxiety, it can feel like a very large emotion, but when you break it down into components like your thoughts, your physical feelings, your behaviors, suddenly it seems to be a little bit easier. And if you had one moment where you broke down your experience of anxiety into what you were thinking at that time, the behaviors you were doing, some of the physical sensations you felt, you may find that it's a little bit easier to do. We also teach patients how to break down their thoughts, how to look at whether their thoughts are realistic, and whether or not and also we can help people even when their thoughts are not realistic. And when they are realistic. So what if you're dealing with realistic stressors, which so many of us have? I had the opportunity to present with a number of members of our team at the a large national conference a few weeks ago. And we presented on a topic, which was, I think I have it right here, what to do when worries ring true. How do you deal with realistic worries? And I've never given a talk where there was there was so many people that came to hear, and it really resonated because these were therapists who were all wanting to understand, how do I help someone deal when the worry is not something that's unrealistic, when it is actually something that's happened. Maybe you're worrying about someone getting ill. Maybe you're worrying about things like that. I would also say that some of the things that we can do is help people with fears of negative evaluation. So if one time I had the opportunity to go to a child preschool art show, and these were the kinds of pictures that I saw that the kids drew. And I'm not showing you these pictures because of just how adorable the kids' art is, although it is quite awesome to see how the kids drew themselves. They actually drew themselves in the fall, and then they drew themselves again in the spring. But I'm showing you this because this was the look on the kids' faces when they showed off their art. And if I asked any of you to go draw yourself, and we're going to put them up here in the Sci Performance Center, we're all going to kind of take a look. I wonder what kind of self-talk you might have that would kind of start to come into your mind. So I know that sometimes negative self-talk can get in the way. I had an opportunity to experience this firsthand as an undergraduate at Brandeis University when I decided, it was a great idea to take an art class. And the very first day in art class, they asked me to sit outside on the banks of the Charles River with a big white piece of paper and a pot of ink and a stick. And they said the job was to sketch out any tree you see. And the only rule was that you could not start again. Well, I started to sketch out that tree, and before I knew it, I was looking around, looking around at everybody else's art, definitely determining that I was not necessarily going to ever be an art major. And then because I was so worried about what other people might think of my tree, I actually spilled the ink on my tree. And I knew I couldn't start again. So then I had to make a decision. Do I, number one, quickly drop the class or deal with it? And before I could go through any of these scenarios in my head, the teacher had already started to walk over. And she actually taught me a lesson that never left me. And I should call her and tell her this sometime. But she said, she held up my painting or my drawing, and she announced the class that there were no mistakes. Mistakes are only how you look at them. And she helped me then to take that dark splotch and to turn it into the tree, which I now still have to this day that I had done in that day. But it was a lesson that sometimes mistakes are opportunities, and also a lesson that the way we talk to ourselves sometimes can really affect our outcome. And sometimes, even when I did the separation anxiety grant, initially, I noticed that kids weren't responding as well as I thought they should to our initial treatment. And that first I thought, is this a mistake? But then it led me to develop Bravery directed interaction, which was, again, a part of parent-child interaction therapy for kids with anxiety. So had I not, limitations sometimes can open doors. So just being mindful of the time, I want to make sure that I noticed a few other strategies that I'd like to leave you with. Some other strategies, again, whether it's coping with stress, being flexible. We went over interoceptive exposure, but I do want to leave you with an important message, because one of the most critical parts of anxiety treatment is exposure, and that is avoidance tends to make your fears grow larger, whether it is a fear of public speaking, a fear of getting on the train, a fear of dogs, and we treat all of this at our center. And maybe you have a more severely, like, okay, this child obviously is not coming down for dinner because the mom didn't read his blog. But I think we all can relate to this. My daughter one time had this teacher who was like this popsicle stick teacher, she used to call, and he was one that had a jar and popsicle sticks with kids' names written on it. And he would slowly draw out the popsicle stick and then say your name, and you were the one that had to answer that question. Well, the entire time, just as they were shuddering, the entire time she was in that class, all she could think about was, is my name going to come out of that jar? And am I going to be the one that's targeted for that next question? And she wasn't able to kind of pay attention. So I think we've all felt like that before. And even though it's easier to say, I just won't go to class, we know that it is important not to avoid. We might say, all right, there's a lot of ways we might avoid, not just I'll just stay home. You might limit your choices. You might decide that that's another form of avoidance. Another form of avoidance is numbing out with alcohol or drugs or letting fear control decisions. That is another form of avoidance. Even taking your little lucky charm with you, we see as somewhat of a form of avoidance because you might attribute the change to, again, your progress to that lucky charm. So I want you to think about something that you were once afraid to do and that you did do. And I want you to think about how your life changed. So think about how your life, maybe it was that first time you jumped off the side of the pool. Maybe it was when you decided that you were going to give your first talk or defend your dissertation or do something that was really big. And maybe it was something like trying something new, running a race. Think about how your life might be happier if you faced your fears. I'll never forget my daughter who was afraid of getting her face wet with water, would never go in the water ever, even when it was blazing hot outside. But then I watched what it was like when her life opened up when she faced her fears. Now you can't get her out of the pool. So I encourage you to make yourself a bravery ladder. Maybe it's breaking the fear into some smaller steps. We say we want to practice in vivo, and that means like in real life, not just think about practicing, but get out there and do it. Whether it is getting on the elevators that you were afraid of or going to pet the dogs that you were once afraid of. Again, you do things gradually. We never are pushing people to do something that they're not ready to do. And you are careful to not avoid or even subtly avoid. We want to reward. So we reward kids sometimes with even high fives and a great praise when they do steps, whether it's like petting a dog for the first time. We try not to relax during exposures when we're practicing because it takes the focus away of that new learning that you're trying to create. And you kind of are almost experiencing that wave of emotion. And that's partly why when I wrote a workbook for teens with panic, we called it riding the wave. Like you're actually experiencing the feelings of the anxiety coming down. You feel it come up and it actually comes down just as you all saw in this room. Our emotions and our physical sensations did come down, and it happens when we practice too. So if you're a parent, practice using this modeling, helping kids to gradually face their fears. And you can do this together or you can do it with the help of a therapist. So in Growing Up Brave, I write out how you would do it if you were wanting to do some of this on your own, because not every child needs to go to therapy to do that. I think a lot of these tools are things that people can use at really any stage of life. So you could even take things in Growing Up Brave and apply them to adults. In fact, it would apply. I would encourage us also to think about mindfulness kinds of strategies, because not everything is about changing thoughts. Not everything is about like experiencing, trying to get away feelings of anxiety. But some of it is also about being in the here and now. And I think technology, as much as it's been good, it also sometimes takes us away from the present moment. So I want you to think about what you see when you're present focused. I started developing an interest in photography, and when I noticed things a little bit more up close, suddenly I realized I wasn't seeing them in that same, I'm seeing them in a different way. And one little girl who is 8, who I know, wrote this poem, and she was only 8, and she wrote a poem about Boston's trees and how the flowers come out and then suddenly they go away. And she said, every petal falling like pink snow, left to right, north to south, every flower, oh so bright, oh so pretty, savor it now, remember it from now to the end. So she's really had a moment where she was able to kind of savor this. Another great technique is improving sleep. We know that good sleep predicts good emotion regulation, and we do this at our center as well, but there's a lot of things you can probably find about ways to help yourself get better sleep, whether it's going to sleep a little earlier, not using your phone in bed, which I know is hard, and getting out of bed if you can't fall asleep immediately within 15 minutes, and remembering that people are there. Because I know there's a number of, I know from experiences in talking to patients as well as to colleagues, that again, connecting with social support, whether it's in our community here at BU or beyond, again, connection actually helps us feel better. So I've talked a lot about different research programs, some of the research we have going on right now, but I'll close with a couple of other samples. I wanted to highlight a couple of students' research. We have one student who's done a dissertation on treating injection fear in one session. And how timely was this when parents were all needing to get their kids COVID vaccines, and some kids wouldn't get them because they were so afraid of getting a shot. And she did this virtually. So she was able to mail parents a kit, be able to do, like, eventually get them to do a little blood, like a finger prick, gradually get them to the place where they were able to go to the pediatrician's office and get a shot. It was really groundbreaking. And another student who actually wrote and illustrated her own children's book to teach parents how to do exposure therapy with kids, or how to do some elements of exposure. So again, some really exciting work. We're currently probably the biggest project that we've got going on, and we've had going on for the past number of years, has to do with, again, that what I started with tonight, which was how do we broaden access to kids to evidence-based treatments for anxiety. And in 4 regions of the US, so we're in Boston, Baltimore, Seattle, and in Miami, our team has been training therapists. So we've trained 170 therapists to date across the nation on teaching them how to use evidence-based techniques for anxiety. And we're looking in this study at understanding better which kids might benefit most from an online kind of therapy where they direct it themselves, and which kids or families might benefit most from a face-to-face type of treatment. That's helpful because it helps us to know how to expand the menu of options. We also are looking at how do we take that treatment of panic disorder and bring it to the schools. You might not think of a treatment for panic disorder looking like a surf shack, where you can actually, with a gamey way, you click on this. This was done actually on Blackboard. This was developed in conjunction with distance education. You're able to kind of click on different objects that you'd need for a day of surfing. And in fact, each object unlocks a whole lesson in kids' fears. So I'm going to just quickly kind of toggle to, so I want to make sure we have some time for questions. I want to show you some of the results of even our treatment for kids with, we had a 1-week treatment where we had patients with teenagers with panic disorder who were 12 to 17 years old, fly from around the nation to come here to the Center for Anxiety to get treatment, again, for 1 week. Can imagine that if you had the option of a 3 or 4 month treatment or a 1-week treatment, you can imagine the idea of getting treatment done in 1 week might mean that your child is feeling happier faster. And I can't think of any parent who wouldn't have that very high on their agenda to get someone better more quickly. And what we saw, that whether you were a child in this, the teens who came into this trial, some did it with their parents and parents were involved. Some did it on their own without parents being involved. And what we saw was whether or not parents were involved, so you see the yellow line and the red line, all kids who got the treatment actually showed a lot of improvements in their severity. And they reported being very satisfied with the treatment as well. And here you see an important thing, which is that their fear and their avoidance decreased over time. And we follow them up to a year of treatment. So this, you can imagine the impact, an individual impact, or the impact then of having a treatment for panic that then could be shared with kids who are like maybe having panic in schools or in other places or pediatric centers. But what's more meaningful to me than even this data is this quote from this one parent. There is no words to express our gratitude after watching her suffer for almost 3 years. It's nothing short of miraculous to have her living the life of an average 12-year-old after a week of treatment. Know that we couldn't be happier with the results of our visit to Boston. So that was, these are the kinds of quotes and the kinds of feedback that you get, whether it's from parents or from kids. And I never forgot one teen who said to me, you know what, I feel like there's no place I can't go now. And that was really meaningful because she really meant that she was nothing she couldn't do. She could travel, she could try new things. And again, opening up lives really feels very, very meaningful through the research and through the clinical work. So just to conclude, we've obviously made a lot of progress, especially over the past several decades, and knowing how do we help people across the lifespan. My colleagues in the area of the adult anxiety area are doing similarly awesome novel work. And again, we need to continue though, and we need your creative thoughts, those in the community and those who are students who are about to consider your next paths. How do we modify our existing treatments to make even more kids get better? How do we make sure that they're present in all communities? So one child drew me a picture at the very end of treatment. She said, oh, this is the anxiety dragon before I faced my fears. So this is how I felt, like I was always being chased by this anxiety dragon. And this is how I feel after treatment. So if you notice, the dragon's still there, but it's a lot smaller and she's a lot bigger, but just sort of maybe it's just how she felt. And a 5-year-old said, well, you have all these fancy measures that you give people at your Center for Anxiety. She's like, I don't know what these papers are that you have us fill out. I can't do those papers because I can't read that stuff, but I'm going to tell you how I feel. And this is what she drew. Pre-treatment, this is how she said she felt. And then she drew a big line and I never forgot it. And then she said, before I said boo, no, no to everything. And now I'm saying yes, yes. So there was a saying here at BU, keep calm and just be you. But I decided to change it a little bit. And I want to thank everybody. And I'm saying, be brave, be happy, be healthy, and just be you. And I just want to thank everybody tonight for your attention and for coming out tonight. And I want to make sure we have time for some questions. Thank you. All right.
All right. Thank you so much, Dr. Pincus, for such an impactful and also a very interactive presentation today. Want to give a shout out to everyone who made it today in the weather, as well as everyone joining online. We really appreciate you all taking the time to come here. So we're going to open it up for some questions from the audience. We also have, I think, some questions through Zoom that we have some moderators in the back. But if anyone has a question, please feel free to come up to one of the microphones and utilize it there. We can also take questions from the Zoom in the back if there are any. So we'll give folks a couple minutes to generate a question. Come on down. Hello, welcome.
Hello. Great. Great talk, Donna. Thank you so much for giving it. I think I've let you know that friends and family members have benefited from your book. So thank you for putting that together. It's been very helpful. So I had a question about you mentioned briefly mindfulness. And as I understand cognitive behavioral therapy from my very different realm that I come from, it's more about kind of challenging and analyzing your thoughts and deconstructing them and reforming them. So it's restructuring how you think about the problems. But mindfulness, at least there are many versions, but in the headspace type of version, you are encouraged to be the observing self and to step back and just say, oh, there's a thought, there's an emotion, just let them go. And I'm curious what seems like anxiety is such a kind of physiologically responsive situation. I just not sure that mindfulness would do the trick. So I'm curious what you think about when is mindfulness appropriate for some types of treatments and when is CBT more appropriate?
Yeah, that's a great question. So, when we think about mindfulness types of treatments, they can actually help us when you don't have a thought that is something you want to restructure. So it's an unrealistic thought. But what if you have realistic stressors that you're facing? And it doesn't only have to be with realistic stressors, but you can actually, instead of judging your thoughts and having to say like, oh, I'm sad that I'm having these thoughts and I'm worried, you're actually accepting that you're having them. You're noticing that they're there, but you are choosing you're not reacting to them in the way that you might typically have reacted in the past. So maybe with cognitive behavioral therapies, we learn to notice what our thoughts are as they come into our mind. In some types of and we're actually merging these things. They're not so separate all the time. So I would say in many of our treatments, when we do cognitive behavioral therapy, we may also blend in some mindfulness-based approaches, especially for something like generalized anxiety, where you have a lot of worries on your mind, and you can't really bring all these worries in the room in the same way you can when you have a fear of dogs or some other kind of fear that's tangible. But noticing those thoughts, noticing that sometimes we react to some of the thoughts, and sometimes overreacting to the thoughts is unhelpful, can be unhelpful. So I think there's like a blend of when you can use, and all strategies can be helpful in a combination. Mindfulness techniques don't only have to be used when you have something that you're worried about. You can actually use it as a practice that you would do, as you mentioned, Headspace. There's other kinds of tools out there to help you to be more in the present moment. And so that could bring joy in other ways. It's not just about let's wrestle with our thoughts right away, but again, it can bring joy in just being able to know that you're more present. It helps kind of training your mind to be more present. And it doesn't mean that then you don't have worries. You may be just treating them like I'm acknowledging that I have some things that are on my mind, yet I know I also still have to function, and I still need to get to school, or I still need to give this talk, or whatever it is that you have happening, but you're not judging them as well. But I think that there's a nice blend of kinds of strategies that can be helpful for different problems. I think mindfulness-based strategies, we had a student who did her whole dissertation on mindfulness-based strategies for teenagers with generalized anxiety disorder. So there's certain types of problems, I think, that lend itself more to those kinds of treatments.
Thank you for that question.
Mhm.
Does anyone else have another question in the audience or on Zoom? While people are, oh yeah, go ahead.
Yeah, I'm also very curious about the mindfulness and the CBT treatment. One question is that, is there any advantage that the mindfulness has over the CBT? And the second question is that, actually, I have asked you before, like, what's the difference between automatic thinking and the normal thinking? I mean, when we are in our emotions, we have our automatic thinking. We can test them with our objective thinking, like whether they are realistic or they are just come from our fantasy. But I think when we are in our emotion, it's very hard to distinguish those automatic thinking and normal thinking, because we need to find the origin of them or the motivation. Why do we come to think so? I'm trying very hard to think about this.
Yeah, that's a great question.
Yeah. So one of some of the benefits of mindfulness-based therapies, some of the benefits might be that you feel a greater sense of well-being. You might feel calmer having done some of those kinds of treatments. I think we've discussed some of those in class too, and maybe even just briefly. I think also you asked about the difference between some of the automatic thoughts that might come into your head, and the difference between just our regular self-talk that we have all the time and the kinds of thoughts that we're dealing with when we deal with therapies. We may be talking about the thoughts that aren't necessarily always true. Sometimes we like to think that everything going through our mind is like the truth, or we believe it. But in fact, there's thoughts that come into our mind that are automatic, but not necessarily always true. And it may be that we have kind of tendencies to think a certain way. So that's the kinds of some of those tendencies, especially if those tendencies are bringing up some negative feelings, we want to make sure that we're kind of targeting some of those thoughts and helping someone know, oh, that's my tendency, is to maybe jump to conclusions, or to think I know what's going to happen, even though it hasn't happened yet, or to overestimate the likelihood of something bad happening, or to totally catastrophize that if I got a bad grade on a test, it would be the worst thing in the world. But noticing what those tendencies are and the ways that we think, so that we don't have to have them be traps in a way, that you can actually free yourself from kind of noticing that there may be some other alternatives, that that's just one automatic thought sometimes aren't something that we have paused to think about. But if we pause for a moment and kind of consider, what are some of the things that are going through my mind, and actually are they things that are helpful? So we don't always think about things as being realistic or unrealistic. Sometimes it can be helpful. Think of it as, is this a helpful thought that's helping me to function well? Or are some of these thoughts maybe not as helpful? So let's give someone else.
Any other questions in the back? I want to give others an opportunity as well. Oh yeah, in the back. We're gonna make you walk all the way to the front.
Hi, we did have a question from one of our online participants pertaining to online tools, and if there is a way to determine what those best tools are, and if there is a way to determine a time limit, and if that changes with ages and the different types of anxiety someone might be trying to treat for themselves or their child.
Yeah, it's a great question. So there are certain websites that actually have very well-researched resources, and then some of them are, so these are places where you could get free resources, whether they are, downloads where you can get information sheets about the things that your kids are experiencing, to actually like an online toolkit. Like there's SAMHSA is one organization, the National Child Traumatic Stress Network is another organization. There's a whole bunch of evidence-based therapies out there. And I think part of it might be going to some of those places where we know we've culled the evidence-based work. So the question that the person has brought up is very good, because sometimes you don't want to just download anything, and you don't know whether that kind of treatment or training that you've suddenly decided to download is actually like the best kind of treatment. I also think, though, if you have questions and you're searching online for something, it might not be a bad idea to have a quick assessment done for your child in a place where you can then get some direction. So some might not realize that, in fact, even at our centers, you don't have to come in to just get a full course of treatment, but sometimes people can actually come in for even just an assessment, as well as resources. And you could even call in for those, you could call in and actually get directed to treatment, even if you don't live in the Boston area. And I think that's something that people don't know that we have as a resource, and we're very fortunate to have here at BU.
I did also have, go ahead.
We talked a lot about how to manage anxiety and cope with anxiety, but I was wondering, because since COVID has led to many more stressors that can cause anxiety, is there anything that we can do or implement in the classroom setting to counterbalance that effect?
Yeah, that's a great question. So understanding the kinds of things to do in a classroom for educators to do, or for students. So I think one of them is for educators to be, and I think we've tried doing some of these things in our class as well, to be conscious of the fact that that not everyone is coping at the prime level that they may have been coping at that time prior to the pandemic, and that there may be things that you cannot see that are on that person's mind, and being more compassionate to know that you may need to have some flexibility with assignments. You may need to feel like, even as I'm talking about bravery ladders, you could, even if you're someone who has a hard time with speaking up, or has a hard time with, engaging with trying, I don't know, giving a speech in front of the class or other kinds of assignments that bring up anxiety. I think for faculty, it's important for us to be compassionate in understanding the variety of intersecting stressors that people have been dealing with, and that it is maybe a little harder. But for that reason, too, how great it is that we can use the classroom as a community. So I think remembering what I said about connecting, and that using our peers and making new friends in class, faculty kind of creating ways to facilitate interaction, getting experiential opportunities, all of those things I think help you feel not as alone. And I think when you're not feeling alone and you know that so many of your peers are probably feeling similarly, I think that can actually also help.
Hi, Donna. Your book is called Growing Up Brave. When I was helping my daughter with her selective mutism, we were with a different therapy group. A lot of the components that you talked about were there. The bravery piece was not there. And maybe that's why it took so many years to finally work through that. I wanted to ask you to just talk more about bravery and the cognitive aspect of that, and saying, what are kids feeling? Are they saying, okay, I'm going to be brave now? Could you just talk more about the bravery piece?
I think we try to teach that bravery is not the absence of fear. So being afraid, you can be afraid and do a lot of things. You can feel symptoms like your heart is racing fast. You can feel a little nervous talking to a new person, and you can still do it anyway. So maybe in my mind, and bravery then is being comfortable with these natural human emotions and being okay with experiencing some of them. So if you're conceptualizing it that way, then bravery doesn't mean that you've done like the hardest thing ever, or that you're the best in your class. Bravery can be a very individual thing. And success, then, when you look at metrics of success, there's lots of different ways that you can measure success. For some people, it may be doing one thing differently than they had done before, or whispering to someone, as I'm sure your daughter had gradually had to get to the place where then she was then talking to other people. So I think in many ways, we don't think about bravery as being just one thing to attain, but it's actually something to practice on a daily basis, and in fact can be done in more subtle ways. And it doesn't necessarily mean, again, hitting the top of your bravery ladder. That's not only brave, it's brave when you even walked in the door. Even making a phone call to our center can actually be that. And kids, as you asked also, how do kids talk about it? They sometimes talk about like, okay, I'm going to be brave and do this, or I felt very brave when I finally approached the thing that I was worried about. I felt very brave doing that. Sometimes they use the term bravery and sometimes they don't. Sometimes they say, I still feel scared. I don't feel brave inside. I feel worried sometimes. But sometimes the cognitions change after the behaviors change. So you start talking, you still feel really scared. You're not feeling at all brave. But again, as you start talking more and more, you start talking to more and more people, then suddenly you start to adapt like new feelings about yourself, maybe increased feelings of self-confidence. And maybe then that feeling of feeling like I can approach new situations, even if I feel some symptoms. So I almost think about the child who drew the big dragon with the little anxiety dragon, like that a dragon was still there. Yeah, I kind of acknowledging it, I'm not getting rid of it. And I think a big theme of this entire evening was really that we're not trying to get rid of all anxiety. In fact, we are kind of welcoming these as natural human emotions.
All right. I think that we have one more question from the back.
Well, we can take one more question.
Okay, one more question.
Yeah.
Hello. This one parent asked for the physical manifestations of anxiety, TMJ, rashes, etc. How do you suggest helping children and teenagers cope with that? Because that often can affect dealing with the other symptoms that they may have, or with coping skills.
Sometimes it starts with a great question about physical manifestations. We see sometimes kids who have, more eczema, and it gets exacerbated when you're anxious. Then you start scratching, and the more you scratch, then the more anxious you might feel. And again, you can see these physical manifestations. So sometimes it starts with teaching some of the core skills, and then what you wind up seeing is some improvement too in the physical sensations as well. So for the, like, clenching your jaw, learning other ways to relax the body. So some of those skills can actually have, you may think of them as psychological skills, but we have to remember the mind and body are quite connected. So you actually can see physically that kids sometimes you'll see some of those kinds of things resolve when kids get treatment for maybe some of the more core issues that are happening.
Thank you so much for that
Thank you.
question. And I think we'll wrap up here.
Yes, I would note that there were a number of other questions online. And so perhaps we'll be able to respond to those. Also, there's requests from people online about resource lists that perhaps we can respond to after the talk. I wanted to thank you, Professor Pincus, for the fantastic work that you're doing and making it so accessible and so successful. So thank you for giving this year's Gitner Family Lecture.
Thank you.
And thanks to everyone for joining us this evening.
I will add, I do have relaxation CDs for everyone in the room. So they're out on the table. You can get one on your way out if you'd like. Thank you, everyone, for joining us tonight. Really appreciate it.